My name is Roma Fine. My son's name is Michael. My son Michael has spastic quadriplegic cerebral palsy. The reason that I originally applied for community care is because as my age has progressed, it has become increasingly difficult for me to care for Mike entirely, and some things have become impossible and other things unsafe.
I've been working at Girling now approximately 11 years, with 2 of those years being in the office, but I like being in the field more. I tend to feel better when I'm closer to the clients. On an average day, I go to approximately 6 to 7 clients. In my particular position, I start cases, so I do initial assessments. So most of the people I see, I'm seeing them for the very first time. So I never know really what I'm going to walk into.
There are really 4 links in the chain of Mike's health care. There's myself and Mike and my husband and the attendant. And if any one of those links are gone, then the chain is broken and we can't function.
Well, when we hire the attendant, a field supervisor such as myself have to meet with the attendant and the client at the same time. And we go through all of the tasks with the client and the attendant, both of them being present. And when we do that, we're able to let them know what things to look out for, what's an emergency and what's not an emergency. We also let them know exactly what tasks they can help the clients with. That way, there won't be any conflict.
Mike wants to live at home with us because he needs our emotional support in order to get through his life and be happy and stay healthy. And it just wouldn't be cost effective to the government either if he were not living at home.
When I get older, I want to stay in my home. So when I go to somebody's home and I'm able to let them know that with just a little bit of help they can stay there, yeah, that makes my day.
But there are millions of people in this world that do not have the support system that Mike has. They don't have somebody who's aware and articulate to advocate for them. And so the system needs to be simplified so that those people can navigate it without having to worry about whether they're going to miss out on what their needs are and getting their needs taken care of.
It's much more than just going in and cleaning their house and being their companion. This is a vital program in keeping the client in their home, helping them to be comfortable in their home, and giving them a high quality of life. So yeah, the attendants are very important.
If they cut that money to community care, then many people like Mike will end up in long-term care facilities and nursing homes. And how can that be cheaper than community care?